So when your fundraising cycle is much shorter, you can raise in smaller chunks and make sure everything's working as you go, rather than needing to bring in 2 years worth of money just so you don't spend that 6 months fundraising in the middle. So my background in biotech is that I'm a scientific founder. I started a company out of the end of my PhD. I've been very interested in longevity for a long period of time, so I wanted to start working in a few more longevity-related efforts. And actually the sort of permissionless nature of VitaDAO meant that I could join and be useful pretty much straight away, and then ended up from there starting out with their VitaDAO and the sort of diligencing different projects, and now working on VITA-FAST, which is one of the lead IPT projects that VitaDAO funded. So VITA-FAST is a project that VitaDAO funded initially as an IP NFT based on science coming from Viktor Korolchuk at the University of Newcastle. It's new science in how we stimulate autophagy in the cell in order to clear up proteins and treat diseases like Niemann-Pick type 1 and Alzheimer's. And now VITA-FAST is an IP token, so we tokenized that initial IP NFT and are working on coming up with new molecules that can stimulate autophagy. The most recent things done by VITA-FAST are that we've gone from a sort of 4,000 compound library screening down to 3 lead series that stimulate autophagy. Excitingly, those seem to have novel compounds that have novel mechanisms of action. Their targets don't seem to have been described in the literature before. And that means that now we can look for new chemical entities that activate those targets, and that's what we're doing right now. So the path VITA-FAST has taken to get here has actually been pretty quick. The initial project was very new science being funded as an IP NFT when it came out of the University of Newcastle. But what we've been able to do is very quickly get into the moment we saw promising results in the lead series, increase the size of the IP token and immediately start ordering new compounds and screening new entities, because we can react very quickly to new positive results or to new negative results. So we can sort of, in small, very capital efficient and very time efficient chunks, add new money, get new data, and then proceed with the project in that way. So one of the things that makes this model really time and a little bit more capital efficient for running experiments is that normally when you fundraise for a biotech company, whether you're doing grant funding, you're on a sort of 1 year to 18-month cycle to get a grant approved. When you're going to biotech VCs, it probably takes 6 months to do that fundraising. So you always want to fundraise for like a 2-year period. In this case, with the IPT token, you can generate new funding within a month or two, especially once the token is set up. So what that means is you can do much shorter and smaller capital allocations. You bring in capital for just the next round of experiments, work out what works, and then if something's looking positive, you raise more money. So when your fundraising cycle is much shorter, you can raise in smaller chunks and make sure everything's working as you go, rather than needing to bring in 2 years worth of money just so you don't spend that 6 months fundraising in the middle.